Hello friends, let us now learn some important points about acute epiglottitis, or we can also call it as supraglottic laryngitis. This is an acute inflammatory condition confined to the supraglottic structures, like there is inflammation of epiglottis, there is inflammation of airy epiglottic folds, and there is also inflammation of arytenoid occurs in the acute epiglottitis. It is a very serious condition which is seen in 2 to 7 years old children most commonly, and sometimes affects adults also. It occurs due to the infection of Haemophilus influenza B, which is the most common organism responsible for acute epiglottitis. Then this is the picture of epiglottitis. Before we go into it, clinical features include they occur very sudden. There is sudden symptoms with rapid progression is seen in acute epiglottitis. Here the child presents with sore throat and dysphagia. Here the child presents with sore throat, dysphagia. Especially sore throat and dysphagia are common in adults, because sore throat cannot be told by a very small kid of 2 to 7 years of age, right? So these are most common in adults, whereas in children the most common presenting feature is dyspnea, that is difficulty to breathe, and stridor is the most common presenting symptoms in a child. It is rapidly progressive and it can cause fatal outcome unless it is treated. The child also has fever up to around 40 degrees Celsius, and there is septicemia can occur in a child. In this picture, on examination, you will see that the red epiglottis, red and swollen epiglottis is seen in the child, and you will also see on indirect laryngoscopy, you will see edema of the supraglottic structures are seen, and you will see lots of secretions which are coming out are also seen. But what is important in this acute epiglottitis is the radiological picture showing the thumb sign. This is the thumb sign which is seen in lateral radiograph. I have one more picture. Yeah, this is the thumb sign which is seen in lateral X-ray of neck, where you can see this thumb sign. Here this is the epiglottis which is swollen, along with many secretions are seen. Treatment is the child has to be hospitalized because there is increased chances of respiratory distress, so and danger of respiratory obstruction. In order to overcome that, we will have to hospitalize the child and give antibiotics. Especially we give ampicillin, and third generation cephalosporins are given, which are active against Haemophilus influenza. They are given either by intramuscular or intravenous route without waiting for blood culture or swab or results. Then you should give steroids to the patient. You can give steroids as hydroxycortisone. We can give hydroxycortisone or dexamethasone is given in appropriate doses. Of IV or IM doses can be given, and we should also see adequate hydration should be maintained by parenteral fluids. Oxygen should be given in order to counteract respiratory distress and dyspnea. If there is any respiratory obstruction, then you should do tracheostomy. So this is how we manage a case of acute epiglottitis. Thank you for watching my lecture. Thank you.